Hi, everyone. My name is Reem Sabouni. I am one of the physicians here at Houston Fertility Institute, and I'm so excited that y'all are with us here tonight. I'm hoping to talk to y'all a little bit about fertility preservation, particularly freezing eggs. And I really want this to be an opportunity for y'all to have some questions answered, and more importantly, for you to learn about the process and see if it's something that might be an option for you. So let's go ahead and get started. So let's start with, what is egg freezing? Well, egg freezing is about preserving your reproductive potential in women of reproductive age. So saying it another way, it's kind of like saving your eggs of today for potential use tomorrow if you need them. This is also known as planned oocyte cryopreservation, if you want the real scientific term for it. So elective or social egg freezing, egg banking, and even egg insurance. So the history of egg freezing is actually pretty interesting, and it stems off of the history of IVF. So it wasn't until 1978 and 1981 where we had the first IVF babies born in the world, with Louise Brown in 78, and then Elizabeth Carr here in America in 81. And it wasn't until 1986 that there was reported for the first time a birth from a human from a frozen egg. And now, close to 30 years later from that initial report in 2013, that the American Society of Reproductive Medicine, or ASRM, finally repealed the experimental label on egg freezing in their statement that says, the success of oocyte cryopreservation has improved dramatically over the past decade, and preliminary data for safety are reassuring. Therefore, this technique should no longer be considered experimental. So why is egg freezing important? Well, women, unlike our male counterparts, are born with the set number of eggs that we will ever have in our lifetime when we are born, and we carry them with us. And through a depreciating process starting from birth up until menopause, we are steadily decreasing the number of eggs that we have left. So starting at birth, we have about 1 to 2 million. By the time we hit reproductive age, it's about 300 to 500,000. And then it's a steady downhill process where you have our optimal fertility from age of 18 to maybe 31. And then at the age of 31, we start to see a decrease in fertility, with a dramatic turn happening at the age of 37 up until the quote unquote end of fertility at 41. A lot of 41-year-olds are still having their cycle, but it's really hard to conceive past that point. And then by the time you hit 45, you start getting your irregular cycles. And then finally at menopause, it's not the fact that we have no eggs, but rather we have about 1,000 eggs left. And we are then bombarded in media with seeing older women getting pregnant, and this feeds our knowledge gap about overestimating both our female reproductive potential and the ability of reproductive medicine to restore that potential. So why women are seeking egg freezing is mostly because of the fact that they don't currently have a partner. They're deferring pregnancy either for professional, social, financial, or even health reasons. They also know that as we get older, we're losing our total amount of eggs that we have left, knowing that biologically we have better egg quality before the age of 30. As you can imagine, these eggs have been with us since before we were born. There's also ethical, religious, or legal reasons to freeze eggs. And then there's this concept of fertility insurance, right? Kind of stash a little away today because you might need it tomorrow. So who is a candidate for egg freezing? Well, candidates generally are proactive women who cannot or do not want to start a family right away, but they want to preserve that potential to have their own genetic children in the future. The best candidates are usually women in their 20s or 30s who are delaying pregnancy by at least 2 years, but that's not a hard, fast rule. So what does the process look like? What does egg freezing look like? Well, Patients that are interested in egg freezing will generally come in for a consultation where we will review your medical history, perform some basic blood work, and do a baseline ultrasound just to make sure we don't have any surprises. Then when you're ready to get started, you would do daily injections for ovarian stimulation. Generally, it's about 10 to 14 days, generally closer to 12 days, where you'll take these injections to stimulate instead of just one dominant follicle that you would release every month, to try to rescue that cohort of eggs that would otherwise have kind of petered out as your dominant follicle kind of takes charge. Then when you're ready, you would get your trigger shot, which would kind of trigger the final maturation of the eggs. And then about 35 hours after that, you'd undergo your egg retrieval and freezing. And this whole process, generally from the start of your stimulation to the egg freezing, generally takes about 2 weeks. And the important thing to know is that the duration of storage, that the data supports that there's no difference in survival, fertilization, embryo quality, and live birth rates if eggs are frozen and thawed immediately versus years later. So in theory, you kind of have them forever at whatever age you froze them, which is very important to know and reassuring. So does it matter where your eggs are frozen? I would say absolutely. It's kind of like a similar process, like if you were going to get LASIK surgery, would you want to go to the center that has, does maybe one LASIK every year versus the place that does it on a daily basis? Well, here at Houston Fertility Institute, we've actually have our own egg bank that's been around since 2011. You can check out our rates in terms of pregnancy rates, and usually they're up to about like 60 to 70% live births, which is awesome. So it does matter where you go, and at Houston Fertility Institute, we really do do this on a very regular basis, given the fact that we have our own donor egg bank, and we have a lot of patients that come in to kind of try to preserve their potential. So is there an alternative? Well, egg banking is not for everyone. And so it's important to know that there are alternatives to egg banking. So you might want to consider, if egg banking doesn't seem the right thing to do, maybe consider attempting pregnancy sooner. There's always the option of embryo freezing. So instead of freezing an egg, you would freeze a fertilized egg, so an embryo. So obviously then you either have a known sperm source or you can use donor sperm, but you're kind of committed at that point. So eggs kind of give you a little more flexibility. And there's always the concept of being a donor, of utilizing a donor egg. So meaning that you would use an egg from a younger donor, and so this kind of is an alternative. And with egg freezing, you kind of get to be your own egg donor for the future if you need it. So that's what I have for y'all. I know I kind of flew through a lot of information, and I'm really excited to spend the next portion of our talk kind of going through whatever questions that y'all may have, or any burning things that you're just dying to know.